So when we ask, why do babies breathe soon after birth? Answers come like change in the medium, touch, light. Basically, it's like the senses are getting awakened, and that's so true. And all these are factors that affect when is the baby gonna take its first gasp. But on the physiological level, it's just amazing how our bodies are miraculously designed to function the way they're meant to function. When the baby is leaving the birthing canal, it gets compressed in the lungs area. And with the help of the surfactants that line our lungs, the liquid that leaves the lungs due to the compressing is making the lungs prepared to have the gas in. 60% of this liquid leaves the baby's body during birth, and then the balance 40% gets distributed in its body in the coming 2 weeks after birth. Talking about how our bodies are miraculously designed, we know that we have two arteries here that always check for the level of carbon dioxide in our blood, baby's blood. And anytime the carbon dioxide level get high, we gasp like that. That's why the babies, when they leave the birthing canal, due to this compression, the level of the carbon dioxide, especially in this area, gets really high, and that's what we notice when the baby gasps, sometimes almost 50 times a minute after birth. We call it tachypnea, this fast breathing, to level up the carbon dioxide levels in the blood of the baby. And then this fast breathing slows down anytime between like half an hour after birth up to 24 hours. It will still be normal. Something worth noting, which is in the medical medium, they want the baby to breathe within 30 seconds. Why? Because they cut the cord within 30 seconds. Why? Because that was the practice followed in an era where surgeries were done in a way where the mother cannot even receive her baby, and sometimes, or majority of the times, she will be medicated with drugs that are not necessarily safe for the baby. This is not applicable nowadays. Now the technology is helping us make surgeries that allow the mother to move immediately after the surgery, and also they claim that all the medicines administered are safe for babies. So why do they still rush cutting or clamping the cord? We know that as long as the cord is pulsating, means the baby didn't get yet his or her share in the from the blood, which is also the oxygen. We just need to not interfere in what is natural, and we don't need to rush clamping the cord to avoid any complications like secondary apnea or similar ones. Allowing the baby to gasp when it's ready to gasp its first breath.